I believe we are a caring community. Frequently, groups rally around social causes like education, healthy eating, and physical activity. These are important steps to reducing disparities in care by creating physical and social environments that promote health. One population has been overlooked, and that is the Spanish-speaking population. Disparities exist between people proficient in English and those with limited English. People with low English proficiency access care less. This means they're often behind on preventive screenings. For patients who do access care, studies have shown that there is a decreased understanding, which leads to low quality care. Spanish-speaking patients within rural healthcare systems have limited access to qualified interpreters related to a lack of pressure within rural healthcare systems to hire Spanish-speaking staff and healthcare system budgetary restraints to compensate interpreter services. Introducing interpreters would impact the entire population of Spanish speakers. Therefore, it is important for us to view this population as a whole. I propose we take advantage of a recent grant to add interpreter services. Spanish-speaking patients who attempt to access care encounter a language barrier, which creates a communication wall. It is impossible to provide high-quality, safe, effective health care through that wall. This intervention would offer hiring preference to applicants who can speak Spanish and pass a medical terminology assessment. These employees would have a dual role. They would perform the necessary job functions for the position of which they applied, and that could be at any level of employment, front desk, doctor, technician, you name it. But when needed, they would be pulled from that position to translate. The grant funding would be used to pay a wage differential. The first benefit for the Spanish-speaking community is access to health care they can understand. Patients cannot be empowered to manage chronic conditions or follow a plan of care if they do not have access to information presented in a format they can understand. The second benefit is improved access. I know people who have chosen to not see a specialist or even have a mammogram because there is not a person available to translate. While the benefits are great, there are some barriers to consider. It may be difficult to find enough qualified healthcare workers to meet the translation needs. Another challenge will be gaining the trust of the Spanish-speaking community. We have not provided reliable interpretation services. It will take time to gain the trust of the Spanish speakers and reach the goal of improved quality, access, and outcomes. All quality improvement processes present challenges, but that is not a reason to ignore them. As a caring, health-minded community, we must recognize the fact that we are leaving a subset of our population without access to quality health care. The next step in decreasing this disparity is bringing interpreter services into our healthcare system at all levels.